tough task for me to let you know about two very distinguished personalities here today for whom I may have volumes to say, but time is my constraint. So yes, of course, being a pediatrician, I tip my balance to first introduce none other than Lieutenant General Dr. Madhuri Kanetkar, the Honorable Vice Chancellor of MUHS Nasik. I could easily say she is the benchmark of hard work, perseverance, and humility. A medical graduate from AFMC Pune University and having completed her postgraduate MD Pediatrics from INHS Ashwini, she was the most meritorious student who excelled all along at Pune University and at Mumbai and was awarded the President's Gold Medal and Kalinga Trophy for the best outgoing student in academics and extracurricular activities. The general officer was commissioned in Army Medical Corps in December '82 as Deputy Chief Integrated Defense Staff in the Ministry of Defense. Her special interest in pediatric nephrology saw her receive formal training at AIIMS, New Delhi, NUH, Singapore, and Great Ormond Street Hospital, London. Not only was she head of Department of Pediatrics at AFMC, but she also officiated as the dean of that college, and it is no wonder that she was the recipient of the Best Teacher Award from her own university, MUHS, in 2008. For her arduous service to the nation, she has been the recipient of the prestigious Param Vishishta Seva Medal 2022, Ati Vishishta Seva Medal 2018, commendations by the Chief of Army Staff in years 2000, 2003, 12, and commendation by General Officer Commanding in Chief. Madam, with these words, I humbly ask you to please share your vision and message for the day.
Everyone, Shri Kakani ji, the Commissioner, Dr. Jayashri, all the deans who have come here, faculty members, and if there are any students, are there any students here? Okay. It's indeed a pleasure and an honor for me to be here with you all, and a special pleasure was listening to the achievements of this laboratory in just 15 years. So this is a true example of dedication, passion coming to the help of patient care and encouraging and taking research forward. I think a time has come we have to do all that, and therefore when she asked me to speak and that there would be academicians here, I thought it would be best to take a topic like that of aligning. Can I have that mic? I think that is better because I can't see the dean sitting there. I thought it would be better to speak on aligning education and research to healthcare needs. I think all of us agree, because I can see everyone nodding, that this is the need of the day, but at the same time, a lot of us don't know really how to. And this, what I thought was, I'll use my own journey of struggling through the past 40 years to reach into this sort of level where I can try and make a difference in all, and I would love to have all of you all being part of it, because none of us can do it alone. So this slide that I had put first was, we are ready to celebrate 75 years of independence, Amrit Mahotsav, and yet when we look into the crystal ball, what do we see? We still see malnutrition, we still see, and now it's going the other way also, obesity along with that, non-communicable diseases. We have everyday problems well beyond the reach of just education, hospitals or research laboratories being able to do that. So therefore, we all know that health has so many aspects and there is a lot that is going on at the national and state level. The question is, are we doing enough? So when we have a question, we always start re-looking at it. So this is where I put this logo together when I had to present a vision to the Prime Minister as part of this TIAC. Yeah, so this is where we all are, and these are the three areas of the triangle, where on medical education is in medical colleges, public health is in our hospitals, where it is overburdened, And research are in research laboratories. So we do not really in all, and I'm very happy to note that you have now collaborated with the research laboratories, because you are really that missing link, and that is so important. Knowledge we know is doubling so fast, and now with IoT and things, I believe it's going to happen every 12 hours. There's no way our medical colleges can keep up with Google Baba. So our students are no more interested in the same old lectures that we would conduct. So we have to reinvent ourselves. And I think medical education takes a very important, and the teacher's role now is to facilitate learning and not try to teach things. And where is the problem? The problem is this, that the undergraduate, after being harrowed through all those 12th standard, NEET exams, finally gets and feels he or she has reached the destination by getting into a medical college, and then start years of this cycle. Is there this thing? Is there a pointer in this? Yes. No, I think it's not working. Anyway, doesn't matter. Just see if it works. Yeah. So this is where this cycle of UG, PG, super specialization, fellowships, we remain in that where at the most information that we part in the undergraduate becomes knowledge at some point, hopefully, which translates to patient care. Not sure. I felt when we were undergrads it happened a little earlier. But today when I look at postgraduates, they are nowhere near the undergraduates. I think every generation feels that. But the fact is we didn't have MCQs and libraries to just appear for exams. So we did do our internship very sincerely. And then by the time we kind of reach there, we reach this stage of grey hair. And it's already too late, where most of us feel, okay, now I've been there, done that, ab aur kya karna hai. So I think that is the time we really need to continue working if we really are passionate about the woes that are causing us. So being a nephrologist, I can't help bringing the kidney in. And I thought, let's start with being doctors, we need presenting complaints. And today is that public health is not improving. I mean, not at the rate that it should. It's definitely, but it's just like the roads. The more roads you build, the more cars are there, and there's always a traffic jam. So we have problems. Patients losing faith in medicine. They no more, because Google tests them so much, the educated ones ask questions, the uneducated ones, when they see outcomes which they don't understand, they beat up the doctors. And there are escalating out-of-pocket expenses, which is increasing poverty, because 70-80% of our people are still dependent on their own income, which is so sad, in spite of all the budget that gets spent on health. So what is the history of present illness? That doctors are losing respect. I don't think I need to read all this, because in corporates they are dragged to courts, in public hospitals they are beaten up. That is in spite of, the toughest education today is medical education. You start, it goes on for years, it goes on lifelong, I'm still learning, and yet, and you're there for service, you're answerable to everyone as a clinician. Very few people are answerable to anyone. When you sit in offices, a file can take month. No one is, you can at the most say why it's not happening and say, wo to aisa hi hoga. But a patient, the doctor is answerable to the patient, to the relative, to the in-laws, to the children. Anyone and everyone can, even the neighbor can ask questions, and the doctor better smile and answer. So it's high time we start letting people know that. And the escalating medical costs for investigations and treatment, where I'll quote my teacher, Dr. Amdekar, who said that we've all reached miss, where we start when the patient walks in, we start with management. Then if we don't, the patient doesn't get well, we start investigating. If it still doesn't, then we look for some signs. And nahi to then we ask symptoms ki bhai problem kya hai. So it's something, it's just very, very sad. So it's not one responsible, it's multiple problems. So therefore, when we have a multi-system failure, it's not just education, health and research, it's a multi-system failure. So we need a multi-pronged attack, and just there, as in CKD, we have stages of, where we start treating. So we need to stem, and the reason I'm showing this is what I'm trying to do at every stage. Bring changes in medical education, improve doctors' stress in life, change the perception of public. Everywhere I go, I keep bringing this up as to why black coats are now ruling the white coats. This is something, and it'll continue to happen unless we change ourselves. Partnership in healthcare is very important, and we have to use innovation and technology. So therefore, this was just one slide that I presented when I had to speak to the Honorable Prime Minister as a member of the Scientific Technical Advisory Committee, that's the PM's TAC. I said कि सब चीज़ में revolution हो गया अब health में. This was about 5 years back. So I said इसमें होना चाहिए white revolution, green revolution, अभी health revolution जब तक नहीं होगा. And unless we don't have these triangles, that was just 2 slides I'd put in. I said जब तक शिक्षण, अनुसंधान और आरोग्य एक साथ एक दूसरे से बात नहीं करेंगे तब तक कुछ नहीं हो सकता है. And if we're talking, they're all good words. AI, machine learning, automation, innovation. But unless we find what the problem that we are trying to solve, there's no point aping the West. We have to find our own solutions. So therefore, what is this? And I'd like to quote this scientific panel for health, that what we need to do is prioritize research, and that can happen only in clinical labs like yours, in hospitals, where we need to say what the society and where should research. It is not the laboratories who will, you can have blue sky research 50%, but you have to have top-down approach to solve a problem. So therefore, prioritize the funding. And this is this thing which I've shared with DBT, DST, that if you have 50% spent on blue sky, you need that. Let's put 50% on what are our main problems. I think that is so important. And going back to public health of whether it's mortality or daily, we need to relook at that. And when you look at that, this is what, I mean, this is an old one of just changing from 1990 to 2010, and see how the jumps have occurred. And our whole health care system is now moving towards the non-communicable diseases of ischemic, COPD, diarrheal diseases. So whereas we are working a large amount in infectious diseases, we have been able to bringing in, and we've identified those problems. So while we celebrate our success in infectious diseases, we need to start thinking big. CKD, diabetes, hypertension, we know it's already on us. So, but what are we doing to really look at that? So this is something also, if you look at the leading causes of death in India, and from just 1990 to 17, and you see that the whole spectrum has changed, and look at the new things that have come in: lung cancer, breast cancer, cervical cancer, and we know that all these have a correlation to genetics, to viruses, to various causes. So are we doing enough for early diagnosis? Are we having our own panels? Because our population is huge. It's not enough to ape. We have to find low-cost investigation and early screening for these. So that's, when I talk of this, therefore I said I would share my journey. And I love showing an evolution, because all of us, all the faculty here would kind of, understand and relate to it, that when we are students, we are probably still bent down because the spine is still becoming stronger. But as you go along the path, you're probably the straightest as senior faculty. You feel, you have the senior residents, you have the students, you have the junior residents, and you're a king. And then the administration starts making you bend down, bend down, bend down, bend down. And by then you're again sitting there. As I see, I'm again back to my books, trying to learn new tricks. And realizing that, oh my God, after 40 years, there's so little I know, and the knowledge has gone so fast, I need to learn. So we need to get back to our books and need to learn so much more. So this is what I thought I'll share. And therefore, slowly in my life, this education which was there, by the time PG, it was for patient care. Research was nowhere, because it was like in our times also thesis ki ek necessary evil hai, ek khatam kar do. And even today postgraduates treat it like a cookbook, and I keep telling them this is not this who's that famous cook, uska cookbook mat likho, please do some. Yes, Sanjeev Kapoor, absolutely. So therefore my journey was more about, now as the grey strands came in, it was how can this be aligned, and then it went on to make those differences. But when we talk of research, and this is something I'd like you to take back to your students, that when we talk of research, it's for clinicians at least, it should be, can my research find solutions? The scientists are doing basic, let's not try to, let's collaborate with them, but let's find, and when we, first I have to be sensitive to a problem. We get so bogged down with our daily clinical load that we hardly have time, and our solutions may not be always therapeutic. There are a lot which are social, which we realize. Then can I find a solution? And then pediatricians love this AFAS, which is affordable, feasible, acceptable, and sustainable. A one-time great research is of no value if it doesn't have the AFAS. And then we soon realize we can't do it alone, and we need resources and we need teams to work on it. So therefore, the same thing, luckily somewhere, even as a young faculty, I thought that if it can't be done, I have to find a solution. So when it was in the armed forces, pediatrics was low, and neonates was even low-key. We had no NICU. So back in the 80s, I sort of in corridors, I said, why should the baby die? And saved for some of the first babies, which were 600, 700 grams, and without ventilators, sitting there day and night, doing all sorts of things. And it was so rewarding when I was in Delhi, and this girl caught up with me, and here she is studying for her IAS exam, and it was the first baby had saved of 650 grams. And she got through social network, and she said, I'm the same Pinky madam who had given up. Even her mother had been discharged, because a gynecologist thought I'd picked up the baby in a kidney tray, brought it to my corridor NICU. And then 3 days later, when I started looking for the mother, I realized the baby was in my lap, and even the mom had been discharged, given, stopping her lactation and everything. I had to redo everything. So, but then these are the beautiful moments that we doctors get to do, because you find these kind of answers. And then came on the nephrology, and realized that there was very little work going on in bladder dysfunctions, and we didn't have those days. Now it's a little more rampant, but when to do. So some of the earlier work I did was in finding non-invasive urodynamics, predictive values of simple tests, and how to pick up bladder dysfunctions. And those are the chapters that I really wrote in everything. Or when I wanted to start dialysis, and CAPD India didn't have a program for children, we started it with this thing, but there was no money. So innovating, improvising, using the same big bag with short and long well cycles to permit school and this thing for children, and teaching uneducated mothers, the pressure cooker to autoclave. So there were lots and lots of things one did, or the stiff catheter, because this, one didn't get easily the CAPD tank-off catheter. So using that, getting a machine. So there was huge amounts, some of which we did publish over the years. But I realized that it was just not enough to do that, and that to do bigger, you needed collaboration. And that is how the next lot of work was done, through collaboration with AIMS, through collaboration with international centers for bringing out guidelines and things like that. It seems like it was this thing, and it's not about saying that, okay, I had a huge, very difficult, yes. But I think the most difficult was 25 years living alone in various parts of the country, bringing up my own children, having a whole ward full of children, doing day-night duty, because you don't get residence in the armed forces when you're posted at peripheral hospitals like Pathankot and Jammu, which is a delivery factory. So, but the reason was that all of us have, and we give up at some point, but somewhere, some tenacity and resilience made me just fight it on. And it was, I think some of the most difficult was, we always hope that the organization keeps doing for us. But I decided if I have to do pediatric nephrology, so what if the Indian Army doesn't want a pediatric nephrologist? I have got my leave. So all those fellowships I took without pay, not pay, went to sing. So it was like for 5 years I did my training in bits and parts, and that was, I didn't realize then, but that was true self-directed learning. I said, I want to do this, it's not here, let me go find a place and do it. So I think that is, can we bring this passion into our students that do something to find a solution, and there's no stopping to that. And I love showing that kinsokuro is a Japanese art, because when a pot breaks and you stick it with some golden glue, it actually lands up looking very artistic. So I think it was those tough 40 years which made me tougher. And I think now I feel the whole world I can take on and fight like a soldier. And therefore, and since I'd fought with my parents to join the armed forces after being a CBSE topper, of being able to walk into any college, joining AFMC was my first battle won. And therefore, whenever there were difficulties, I reminded myself that I don't run away from a challenge because I'm afraid. I run towards it because the only way to escape fear is trample it beneath your foot. If I want to swim, I have to jump into that pool. And to quit or not quit was not an option because I felt my parents would say, we told you so. So that's the last thing any kid wants to listen here, that we told you so. So that kept me going even more. And this is something where, again, I want to share with you, when we look at collaboration, look where we stand. And if you see the top institutes in India, they're only the laboratories. Whereas if you see the top institutions globally, they're all universities. So we don't have any such system. So this is something I had in my mind, that how can our own university, how can all its faculty, and how can we collaborate to reach the next level? And look at this also, Nature Index. I mean, if you see all is China and USA, look where India's collaboration is. It's absolutely at the bottom in 2 digits, where others are in 4,000 and 3,000. So this is something which is thought-provoking, that we need to think big. And for us, it will be it's people who have to come running to us. Today, we have the population, we have the patients, we have data. Data is gold. We've just not harnessed it. So we need to look at methods, and it's time that we look beyond medical people, and this becomes a science by having health informatics, non-medical people ensuring that we have, and there is a national digital health mission, but it's again left to doctors to do it. So the way I told in the armed forces, I think it's for us to go and tell all others. I told all the chiefs that don't leave it to the medical corps. You have to do it. We don't have to do it. We don't need it. You need it to give you scientific evidence. So I think this is something which needs a change. So at that point, then I landed up coming as professor and head, and then that was this time we really started changing a lot of things for pediatrics. Everywhere in the country, pediatrics was a little lower in the armed forces, even because it was more for the serving personnel. And so therefore one realized that you have to be the change you want to see and push things through, whether it's sending residents to this, whether rotation programs, changing the way they think. And after that, I realized that if I have to be an educator, I mean, it's really going back to school, because by the time we reach that age, we feel we know it all. But when you realize you don't know, you say, okay, how do I learn more? So that's when I went and did a FAMER fellowship, because I realized that education was my passion and my calling. So therefore, in that, the first thing that struck me is we need to develop a vision. Because if you're working on something exciting that you really care about, you don't have to be pushed. The vision pulls you. And I saw that when you took me around the lab today, or when you go to any department, till we are HODs, till we are this, we should have a vision of being the world's best department. But then you need to grow on that vision as we become deans, directors and things. And the vision just has to get bigger. So therefore, whether it was developing a vision in 2005 or when I was HOD, that what will be it by 10, what will be, putting it down in writing, which then others continued on and we could achieve it all. So I think that is very important, to spend time to write down ideas after brainstorming with concerned stakeholders. So whether it was, those corridors where I ran the NICU to what we could do now, and it's reflecting the same thing that is happening all over. Or specialty care. The armed forces really didn't have it, but yes, one developed all the special telling among the postgraduates, teaching them to take on all this, because it takes another 10, 20 years for it to move to the armed forces. But it's really heartening to see that the postgraduates of that are now all DMs in various, and I love this picture because each one in that group has been a student of mine, and each one is now running the advanced care for pediatric medicine at the RR hospital in Delhi. And now we've moved on to theme-based clinics, and that's what's the need. Because till the specialty clinics, it's always doctor-centric. I will do this, I will do this. The moment you get patient-centric, you say, if a patient comes, it's a developmental clinic, how can at the same time all be sitting together? So now the clinics have to move in all our public hospitals, all our specialty clinics have to be theme-based clinics. So that's the future.
And the interest for research was never given up. So with DBT, we first set up our research laboratory at RR, where we started looking at cardiovascular outcomes and a complete renal biology program, again with AIMS, CMC Vellore, 5-6 institutions. So that work is going on. And with that, one landed up being the dean. So then how to now make the vision bigger was a question. So that's where one thought that how to create an ecosystem where we can learn from mistakes, an environment of curiosity, because it was no more now about pediatrics or pediatric nephrology. It was a whole, like I said, okay, my children now have, there's an empty nest, but I've got 750 more kids. So it was the attitude which made a huge difference. And with that, we set up our first multidisciplinary research unit as an idea, again, a great teamwork, which is now, and we put in things like 3D printing, all out of this thing like a tinkering lab so that the undergraduates could experiment. So now we have the Epigenetics Lab under it. We also have and again, it was put with timelines, put in writing, so everyone, and because we move on, we don't get more than 3 years, so we had to see that, including the thought of multidisciplinary where Yoga Nidra is being looked at with autonomic functions and things, so we put all that. And then with a stint in Northern Command when 370 was abrogated and there was a huge amount, at that time they said, are you sure you want to go to Northern Command? Because it had Jammu, Kashmir and Ladakh. Even my DG, no woman. So I said, I'm a soldier, I'm a doctor, I'm a teacher. I've done enough of doctoring and teaching, but I've not done enough of soldiering. And it made a huge difference going there because you go there with your heart, you have a different look at things. Going to every post, right from Siachen base camp to every remote area, Rajouri, Poonch, one had and that's when one realized the huge potential, found the problems of epigenetics and the role of reinduction, HAPE. There were so many issues which are now being researched at. So you need to get down to the grassroots to identify problems. But the biggest challenge came, I took over as the first Deputy Chief Integrated Defense with late General Rawat, and COVID happened at the same time. So I was given the responsibility and was part of various groups from the armed forces, and we all saw, I termed it Kojit, and we did a lot of work together. But that was the first time that we came together as a nation. And today, look at that, when ministries, scientists, and when everyone works together. And that is why your lab here is succeeding. You have amazing support from the commissioner, you have from the, all stakeholders. You can do that. And this is something where we saw everything. So when the world lamented, New York Times said, it's going to be a massacre in India. Everyone's going to die like flies. They can't accept it, we did so well. So now there is a maligning thing that, oh, we underreported deaths. We are ready with the publication through our mathematical modeling team, where there's no question of us having, yes, there may be, but everyone there is some amount, but it's nowhere near what has happened. Our case fatality rate is among the lowest in the world. And then it was a time for this thing as part of STIAC. We were the first from the PM STIAC when we distinct out the cloth mask. And it was just out of casual conversation that when we didn't have N95s, something is better than nothing, because we were hit, till we started producing. And we brought out the first masks for curbing the spread of this thing. And this was on 1st of April. And everyone called us a fool because it was 1st April and said ICMR says no, WHO says no. But the PSA's office says wear a cloth mask. And today the whole world has accepted it. So sometimes experience works and evidence comes later. So you continue with it. And that was an opportunity where all the experience of the years helped me get work with the DRDO to set up right from the first jumbo hospital in the country came up in Delhi, and we put it together, and then the protocols could be shared. So it was an amazing, just the way you said microbiologist, everyone realized that everyone is required, and COVID really has taught us. I hope we don't let go of the lessons learned. And we take this forward, because being prepared, we talk of CBRN, that's your chemical biological read. Today the war is no more only in the war field. We are seeing what's happening in Ukraine. It's there at doorsteps. And for all you know, the next biological can be just like COVID. it can come into your household and spread like anything and will be caught unawares. So today it's going to be, and the Chinese colonels have written way back 15 years ago, the unconventional warfare. And they talk of just this, what is happening today, whether it's digital, whether it's this, that's going to be tomorrow's wars. So it's no more going to be just the armed forces, but I think we medical people are very, very important part to be capacity building, and therefore workshops like yours, and now MUHS is looking forward and would like your expertise to help up set up these courses. And then this research continued, so I was part of the Sutra model with Manindra Agarwal in Vidyasagar, where we really showed how actually modeled, and we are continuing to do, we've done the third wave, we've done this thing, and it's turned out that, and we called it Sutra to sound Indian, because for the first time we could describe susceptible, undetected, tested positive, recovered or removed due to death analysis. So, and we've done differential equations to really show from a time series data available. And we're ready with it in an analysis for 40 countries, which shows why India did so well. Because we did not follow the zero COVID policy. We let infection and immunization go parallelly. It was more of this, but the mathematical model brings it out beautifully. So our publication is just ready. So this is how we model the second. And during that time, we saw that there's a huge gap in mental well-being. When we are unfit, we go to the gym. But when no one talks of mental wellness. I was just telling you at the tea. And keeping this in mind, again, using the experience, this thing of collaboration under the umbrella of the principal scientific advisor, brought top institutions together, NIMANS, AFMC, NIC, and all of them with CDAC, Bangalore, and we've rolled out a digital wellness platform which is being tested in limited things and should be rolled out, and we're looking at ways of merging it with the national mental mission that is being increased, and this year's budget has kept a lot for mental wellness. So therefore I look at it that there are challenges and there are opportunities. This compartmentalization of education, workplace silos, we are scared, we don't trust anyone, so we have IP issues. If I give my knowledge, will there be a problem? But today we have ways of collaborating. Then financial constraints. It's so nice to see I loved your picture which had all the women. Otherwise, as we go along the way, today 60% of women, and in dental I'm told 80% of girls are joining because they're doing very well. But when you reach at top positions, I've not put a picture here, but the last award ceremony, it just struck me when we were sitting on stage and all the award winners came. There was all girls with one boy, and there was this front row of all the deans of faculties, blah, blah, and there was one woman. And I said, how does this land up happening? How can we make sure that all these women reach the front rows? So I think that is a challenge, because inclusivity, the corporate world has gone in. I think we need to bring it into our systems. And what are our opportunities? The new national education policy, which has opened up, but we are still hesitant. The competency-based medical education, it's there, but we are hesitant. I think we have to jump into it and say, this is the nurture, and let's try it out. Then you have all these research foundation is going to be formed. Bioclusters, I'll tell you about it. There are so many schemes, and there are society partnerships. So these are some opportunities. CSR is now available for research. So it is for us at colleges, universities, stakeholders to reach out and make the most of it. The changing paradigms we all know in healthcare. So I think it's time we have departments of bioinformatics in medical universities, departments of, in health technology. And with that in mind, I've launched the summer internship program, letting our children go into all these and just open their minds for 2-4 weeks. And it's very heartening that I've already have all the IITs asking us, please take our students into your medical colleges. So though it's happening at lower level, we will formalize it through the university. And the disruptive technologies, yes, like we just said, bioinformatics, big data analytics, GIS, I think we've just not done enough. We're talking of One Health, and one visit to Nagpur, and I found in one locality, There is NERI, which is for environmental health. There's this Institute of IT and Technology, NVIT, which is there, and there are the medical colleges and dental colleges, and everything is there. But they said, we've never talked to each other. You called us all, so we all came. So whereas I just told them, I said, just look at 10 years data. There's the animal husbandry and this institute which is there. I said, you give your animal data, you give your patient data, you give the environmental data, do a GIS mapping and look what you'll find. We can do it. So I think we have to just start thinking big, and that's so important. And telehealth, we all know, we were very lucky as part of the Board of Governors of the Medical Council of India. When it was with Dr. Paul, I was on that committee, and we literally brought out the telemedicine guidelines in just 1 month of working day and night, and were almost, and then the last week was COVID aa gaya. Dr. Paul said we have to let it out, and we brought it out, and e-Sanjeevani today has been a success, and the same thing in 3 weeks I rolled it out for the armed forces as Sehat. So these are ways where innovation and digital technology can be harnessed. And the concept of One Health, now we are going to have a center in Nagpur, but I was very happy when you told me about the this leptospirosis, which you linked up with Gujarat and how your institution did that. So it's high time we start working together with veterinary universities, because there is going to be these jumps, and there is going to be wherever, because we have gone into animal territory. So we are going to have this, and that's the easiest to do, is bring in a mutation and let go and control the whole world. So I think this is going to be so important. And even in the STIAC, one has insisted on having a few health, and there is waste to wealth, which is also there, and a biosciences for human health. So that mission is going to be launched, where we would have our complete genotype. We have the Indian genotype of just 1,000, but it's not a representation of the complete ethnic. So this is a project which is being launched from top down. And city clusters is another attempt from the STIAC itself. We have mooted it through Niti Aayog. The first ones have been formed in 4, and Ahmedabad has been added now. But these are places where, under the thing of a city cluster for global excellence, we are trying to see a community and local participation, public health, corporate labs, and universities. Because otherwise they are watertight compartments. You don't have corporates coming and teaching, so you don't have the real life experiences. So we are going to do that, and we tried to do that, but by the time it came out, the NMC changed it to only international. I think the old system of having so many consultants coming and teaching, even if it's over and above, it increases the scope of doing real-time work, and not just tailored, structured, tertiary care which is there in our government colleges. And that, with that in mind, got the opportunity to work with the erstwhile Board of Governors before the NMC came in. And actually, they are now rolling out all those things which we did put together. And we brought out 256 changes, some big, and some are being rolled out slowly. For example, I personally had the opportunity of preparing the next exam and writing up the whole white paper. So what one, without thinking of going back and doing all that FAMER, really helped. And with that, when everyone thought, okay, now I have to say bye-bye. I said, okay, have I finished, or do I want to enjoy life now and tick off my bucket list and spend time with my grandson? But I felt I haven't made enough. I haven't given back enough. And that is why I applied for it, much to the surprise of even the governor. Said, why you stay? Abhi ye sirdard kyun le rahi ho? And I said, sir, kisi ko to lena padega. So I said, I'm sure I can contribute something which will make a difference. And with that, this vision document, within 15 days I wrote it up, and it's on our website of the MUHS. I'd love all of you all to read it, because if something that you all feel needs to be, or you can contribute, I tell people, that I would like to do this, and we'll say, let's do it together. That should be its participatory changes. And the research continues. We've undertaken the Malegaon, and it's been phenomenal, because with vaccination before Omicron, with vaccination levels of 2 doses only up to 15%, no use of masks, They were still, we were wondering, and the collector in Nasik told me, वहाँ पता नहीं किसी को इन्फेक्शन क्यों नहीं हो रहा है. So scientifically करेंगे. Let's go together. Both of us went down together, convinced those people. 3,000 samples were collected in 10 days' time, and we've already got the results. And now that you've told me you're going to look at this, I'll involve you to help us with the cell-mediated, which we will look in a select population. We've taken the first round, and the results are amazing. I mean, this is the time series. We've modeled Malegaon with Vidyasagar and Manindra Agarwal and me, and we found that whereas everywhere else Omicron hit the roof, Omicron in Malegaon was very small. So this is where, and it correlates well with the, I have not, I think, shown the this, but the seropositivity before Omicron was 94%, and very high, about 30 was, this is where we took out, and we found such a high seropositivity. So we are looking at all the possible reasons that went into it, because, and then we're going to see 3 months, May after Ramzan, we will take another set of samples, and from the ones who've petered down, we'll look at cell-mediated, and I'll take your help for that. So I think trying to find scientific answers is research, and that is what will make us big. Our problems, we have to solve them. So I'd love to share that just on Friday, we've signed, we've got the entire huge heritage property in absolute prime location in Pune. They've given, the trust has given the entire property to MUHS to set up a genetic lab, and I'd request your team to give the help with expertise to set it up, so you can concentrate on infectious diseases. We could get on to the other genetic things of, and the main aim is start a course for clinicians. Today with MedGenome, with Origin and all these companies, especially pediatricians, gynecologists, clinicians ask for tests without really knowing when would you need a clinical exome sequencing, a whole genome sequencing. I mean, there are so many tests. But we ask, oh, what is a WUS? How do you interpret it? Why do you need a background information? Because it just throws up and then you don't know what to do. But you said, okay, you've done a genetic test. So I think it's important for clinicians, and our first course would be that, along with training paramedics, and then we could have together develop a syllabus which can do capacity building for all the future labs that are coming up. It is the responsibility of the university. Our new PG institute, in 3 months we've started it rolling, which hopes to be something which will be a MD PhD program. So this was envisaged. IITs are setting up hospitals. We've never thought of setting up engineers. Why are they not coming to us? We have the patients. They want to set up hospitals. So it's time we started thinking big. And a university with its regional centers, Bombay has a regional center. Bombay's infectious disease center is not connected with you all. I mean, we are working in silos even now. It's corporation, it's state, it's center. They don't talk to each other. I think a time has come, we have to work together to find solutions. We are starting complete automation, traveling skills lab, because colleges, good colleges have the skills lab. What about the 403 colleges under MUHS and the paramedics? I think everyone needs to have basic. So we're going to use our mannequins to take them to the remote parts. We've already got a digital library. We are starting degree plus online courses of capacity building. Soon you all will, if you all can help with some, I'd be happy. We'll have an LMS and interns who've never learned practicals of even doing, whether it's a literature search, whether it's communication skills, whether it's biomedical waste. These are not important for the exam, but I think they need to know. So we will soon be making it compulsory, of your choice, any 5 you do, and put on a reach certificate. That's my vision. Please help out with it, and this is something we can do. Of course, we are doing all other things of Chair of Excellence, and I'm soon going to launch deans would have heard about it, a Kulu Guru Ka Katta, which will be an online forum to connect with students. I'm no use if I can't reach out to teachers, to deans, to students. I can't sit in an ivory tower and expect to bring a change. So this is my own initiative. So to the end with, I think I've spoken too long already, but you'd given me the freedom, so I thought I must use the opportunity of addressing such an august, unsuspecting crowd who had to sit there, couldn't leave the room. So, and I take pride in having been a soldier, reached its pinnacle. A teacher, again, I never thought I'd land up being a vice chancellor. And as a doctor, setting up first pediatric, it was swim against the tide and make a difference. And I loved, and I feel very humbled and honored to have done it all. But as a soldier, I've always learned nation first, organization, subordinateness, and self is last. And you have to turn out punctual, fit mind in a fit body. I have, as a teacher, I feel practice ethically before preaching. There's no, my students are going to see me. Medicine cannot be taught in classrooms and through textbooks. Otherwise, they can sit at home, and the China and Ukraine students are doing them huge numbers. Why do they not? Because they are not being able to connect with their teachers and their patients. So let's not ruin what we already have. Competence and knowledge are paramount. None of us know everything. Let's go back to learning. I'm still learning. And doctor, compassion, caring, empathy. At our convocation last, I loved the statement by our Honorable Governor, who said, मेरे को पूछते allopathy, homeopathy, मैं कहता हूँ मुझे सिर्फ चाहिए sympathy और empathy. I think that says it all. And combination of head and heart. It's not enough to be so perfect and scientific. You need to strengthen that corpus callosum to join up your left and right brain to find your ikigai to do what you really want to. Because if a thing is worth doing, it's worth doing superbly. Otherwise, let's not do it. And for all the students, I tell them that in this day and age, this is so that you can share it with them. You just have to Google to get a map. But my definition of map is a mentor, an attitude, and passion. And it's only when the teacher and the taught move on this journey together, then you have Sahana Bhavatu, Sahana Bhunaktu, Sahaviryam Karvavahe, Tejas Vinavadhi Samastu, Ma Vidvishavahe. Jai Hind. So vision without action is just a dream. Action without vision is just a task. But action with vision can change the world. So let us all work together to bring about a change to what we want to do. I needs to go away, we needs to come in. Illness will go away, wellness will come in. Jai Hind. Thank you.
Madam, you have left us absolutely amazed at the quantum of your work. We are so happy you didn't start ticking your bucket list but took up as a VC. And today, absolutely enriched with your experience, knowledge, and these were words of wisdom and couldn't be anything otherwise.